mynews.studio.
Malaria disappears from 3 countries, blindness from 6, and a single vaccine dose is stopping dengue. Has 2025 finally changed the story for global health?
Today is December 19th, 2025. What does it mean when the world map changes, not by borders, but by the diseases that are gone? This year, long struggles against malaria, trachoma, sleeping sickness, measles, rubella, HPV, and dengue saw real progress, unlike anything we've seen before.
Yeah, let's start with malaria. In 2025, Georgia, Suriname, and Timor-Leste were certified malaria-free by the WHO. That means 47 countries and 1 territory now have no malaria. These aren't isolated cases either. For example, in Georgia, every malaria case was traced, and vector control teams followed up quickly. Suriname sent mobile clinics into mining and forest areas, bringing rapid tests and treatments to people directly. Timor-Leste leaned on political support, community health workers, and widespread use of insecticide-treated nets. Is there a pattern you see here?
It's not just about having new drugs. It's about building systems, surveillance, targeted interventions, and sticking with it over time. But malaria isn't gone everywhere. In 2024, there were still 282 million cases and over 610,000 deaths, with Africa carrying 95% of the burden. Drug resistance, funding gaps, and new invasive mosquitoes are all still big threats. So, do you think the success in these countries can be repeated elsewhere, or are their situations unique? Do you think the success in these countries can be repeated elsewhere, or are their situations unique?
That's the challenge. To repeat these results, you need funding, a stable environment, and the ability to react quickly when cases are imported, especially where malaria is more common and health systems are weaker.
Now looking at trachoma, 6 countries eliminated it as a public health problem this year: Mauritania, Papua New Guinea, Burundi, Senegal, Fiji, and Egypt. Trachoma is the leading infectious cause of blindness, but what worked here wasn't a new vaccine.
Exactly. The safe strategy, surgery, antibiotics, facial cleanliness, environmental improvements, was the backbone. Countries ran mass drug campaigns, invested in water and sanitation, and prioritized community education. But it's labor-intensive. It needs everyone in the community to get involved, and infrastructure, especially water and sanitation, takes a long time and a lot of money to build.
Right, and the places that are hardest to reach, those are often where trachoma remains: remote, conflict-affected, or extremely poor areas. So, can we really use the safe approach everywhere, or do we need something different?
Let's move to sleeping sickness or HAT. This year, Guinea and Kenya eliminated it as a public health problem. Guinea in January, Kenya in August. What did they do differently?
Both countries focused on active community screening and fast treatment. Kenya also combined tsetse fly control with better diagnostics and new, safer oral treatments. Partnerships mattered. A lot of coordination between health ministries, the WHO, DNDi, and local communities. But eliminating it as a public health problem doesn't mean zero risk. They still need to keep up surveillance, or the disease could come back.
Exactly. Expanding this success to other regions will take steady funding and a way to reach people in the most remote places.
On to measles and rubella. Cabo Verde, Mauritius, and Seychelles became the first African countries to eliminate both this year. That's huge, since measles is so contagious. What made it possible?
High, consistent vaccine coverage, strong systems for catching imported cases, and quick outbreak responses. But globally, it's uneven. Some countries are losing ground because of missed vaccinations, especially after disruptions from COVID. Vaccine hesitancy, weak health systems, and conflict are big barriers.
Let's look at HPV and cervical cancer. The goal: 86 million girls vaccinated in Gavi-supported countries by the end of this year. That could prevent 1.4 million cervical cancer deaths in the future.
This was possible because of lower prices, better supply management, and simpler dosing. often just 1 or 2 doses, usually in schools. But not every country is keeping up. Middle-income countries are falling behind, and screening or treatment for those already exposed is still limited.
The single-dose dengue vaccine from Brazil is another milestone. Why is just one shot important?
It's about simplicity. Earlier dengue vaccines needed several doses. One shot makes mass vaccination much easier and cheaper, especially in crowded cities. Brazil's own scientists and regulators were able to act quickly. If results stay strong, other countries might follow, but only if they can afford it and have the right systems in place.
If we step back, these victories have a lot in common. 5 things show up again and again: long-term political support, strong disease tracking, combined interventions, new tools and treatments, and partnerships at every level, from local to global.
And on the other side, the usual obstacles: funding gaps, fragile health systems, drug resistance, new invasive mosquitoes, unequal access, and trust issues. Even with a clear plan, progress isn't guaranteed.
So where does all this leave us? These milestones show that elimination is possible, even in lower-income countries. The same skills, tracking diseases, supporting community health, fast vaccine rollouts are what we'll need for future outbreaks and neglected diseases. But will the world actually invest enough to keep this going? Or will 2025's wins end up being just isolated examples?
That's still uncertain. These aren't mission-accomplished moments, but they prove elimination can happen. We have the tools and real-world evidence now. The real test is whether we can make this the norm, not the exception, for global health.
Thanks for joining us as we explored how 2025 became the year diseases lost ground, across continents, through coordinated action, and with lessons we can use in the future.
Thank you for listening. This episode was brought to you by mynews.studio. Try it now for free.